A major step toward patient safety and consumer transparency after our investigation. The Texas Medical Board just revised its guidance for practitioners in facilities offering services like Botox injections. The revised rules clarify such procedures are considered medical and must be administered by a Texas licensed physician or others qualified to inject under a doctor's supervision. Facilities where injections happen must now post the name and the board license number of the delegating physician in all public areas and treatment rooms. All advertising must also feature that physician's name, and all staff must wear ID showing their name and credentials. This comes as a state lawmaker pushes for more oversight surrounding Botox, following medical emergencies, possible lack of supervision, and our team's reporting. We uncovered how anyone in Texas can become certified to do the injections, happening sometimes out of the back room of salons and boutiques. Now, Investigator Arezow Doost explains health advocates worry about severe outcomes if lawmakers don't address these concerns this session.
It was filed back in November.
Dr. Kelly Green is an ophthalmologist in Marble Falls.
It got referred to Business and Commerce.
And in the last few weeks, she's had her eye on Senate Bill 378, which would prevent barbers, cosmetologists, and estheticians from administering Botox and other injectables unless they're licensed or authorized to give the shots.
I have had patients who've had their eyelid come down from Botox done elsewhere.
Patient safety is why Dr. Green says she co-founded Texas 400. The grassroots group of doctors advocate for patient protection legislation.
It's considered, medical. It's not considered cosmetology. So it's not appropriate for someone with no medical training at all to be doing.
Anyone can get trained to administer Botox in the state as long as it's under the supervision of a medical professional, like a physician assistant, an advanced practice registered nurse, or a doctor serving as a medical director in case there are complications. We previously shared the story of a woman who had a medical emergency in Dublin, north of Austin.
Everyone was just kind of panicking and was like, oh my gosh, what's going on? And then the EMS and police arrived.
The woman wanted her privacy protected, but told us she fainted after getting a Botox treatment at a shop in town. An EMS report says she had a seizure and was vomiting. The police department launched an investigation into whether or not the injector was practicing medicine without a license. That investigation is ongoing. A spokesperson with the department says it's now working closely with the FDA. Why does Texas need this legislation?
We need to make sure that injury and harm does not occur.
Senator Charles Schwartner, who is also a doctor, refiled the bill this session to give the Texas Department of Licensing and Regulation authority to discipline those professionals if something goes wrong.
Whenever you're injecting something, speaking as a surgeon, it's important that the person doing that injecting or doing that cutting knows what they're doing.
Cosmetologists wouldn't be able to do something more invasive than a facial or other, waxing.
Dr. Green says it's time for more oversight.
Some of this is being done in hair salons, boutiques. We'll have like a little closet set up in the back where people are getting Botox. It's completely bonkers.
Earlier this month, Senator Schwartner's bill was referred to the Senate Business and Commerce Committee. A hearing hasn't been scheduled yet. The Dublin Police Department hopes to be at that hearing to share more about its investigation with lawmakers. And we'll, of course, keep you posted. At the Capitol, Arezow Doost for State of Texas.
Thanks, Arezow. Beyond the revised guidance we told you about earlier, the Texas Medical Board can take action against doctors and other individuals for either improper supervision or the unauthorized practice of medicine. Since our reporting in May, TMB disciplinary records show more than 20 new actions taken against individuals specifically related to med spas or non-surgical cosmetic procedures. Our investigators have not found any action related to the Dublin case. A TMB spokesperson says the agency cannot confirm or deny any complaints or investigations until action has been taken. Check out our complete coverage right now on our website. Just look for the links in this week's State of Texas story. Thank you again for joining us for State of Texas. I'm Dylan McKim. We'll be right back here next week to bring you an in-depth look at Texas politics.